Hey, so quick. Hi, everyone. Hi, baby.
Hi.
Hi.
Oh.
Welcome back, everyone, to another Talk Story Tuesday. I am joined with Dr. Tara Lawal and Nika Smith. And so today we're going to be talking about the ick factor. And I don't know if y'all know what the ick factor is, but um, we're going to be diving more into it about infections that you can experience during pregnancy. But before we go more into our conversation today, I'm going to do introductions. And so on the screen, we have a mother of six, Miss Lika Smith. And who's that right there?
And baby.
And baby.
Hi,
Hey, baby.
baby.
Too young to learn about prevention. Yes.
That's a good point. Hi, everybody.
Yes. And on the right screen, we have our childbirth educator and specialist, Dr. Tara Lawal.
Hi,
Yeah.
everybody. It's good to see you.
Yes, and a reason why we brought up this conversation is um, during the month we had a community member come by our office, somebody from the public health field, and they stopped by and they mentioned the high rates of infection that we see in our community, and more specifically during pregnancy. And so today we just want to share the expertise and maybe some stories that have happened in the community so that way later on it won't happen. Um,
We want to have a frank discussion,
yes, big discussion.
whatever frank is.
Yeah,
He's frank.
Thanks, Frank.
it is frank. Oh, yes. So, huh. Today, so today, what are some of the common types of infections that we see in the community? I am not too sure.
Well, it was really interesting in one of our classes. Somebody was explaining some of the symptoms that they felt. Like, I, and when she was talking, she was like really tired, feeling feverish. She said, then I was like, does it burn when you pee? And she's like, yes, it does. And I'm like, how long has it been burning? She's like, oh no, it's been like a month.
Ooh.
And I'm like, a month? And I go, have you ever had this before? And she's like, no, I don't. I've never felt like this. It's so annoying. I have to pee all the time and it burns. And so I was like, oh, this sounds like a UTI.
Mm.
And then she's like, what's a UTI? And it's like,
Right.
oh, okay, wait, we got to go back. And there's some things that we just got to talk about and think about what are infections, what are things that could be bothering us in pregnancy, and then where does it come from, where does it start, how could it even happen to me. That's the other thing. Is like, how do you even get a UTI? So
Mhm.
I think that's kind of what sparked our interest in throwing this talk story, because one, people don't know that there's infections out there, and then to have the public health come out and say there's a lot going on. And then I was at a King County meeting and they said there's a varicella outbreak. And
Mm.
do you know
Wait,
what
what's
varicella is?
varicella?
Chickenpox. And so it's like, I don't know, back when I was a little kid, we had chickenpox to get chickenpox. Like, we had
Mm.
chickenpox parties. Like, my cousins came over, we all got chickenpox together. But that was 30 years ago when we used to do that. Now people get shots to
Mm.
prevent chicken shot. You can get a vaccine. The thing is, now there's a varicella, there's a chickenpox outbreak going on in the community that can really affect pregnant women. And
Mhm.
those are the most vulnerable. So we had to go down a huge rabbit hole with with the King County investigators to see who touched any of the pregnant people that live in this community.
Mm.
Oh.
And there were like three different doctors that saw that one person. So we had to like tell everybody, we were exposed to somebody who's been exposed, you know,
Mhm.
and that's how scary it is. And those, and so just thinking there's a lot of different infections that are out there. There's bacterial infections, like the one that I have right now. It's an upper respiratory infection. So that's going around right now with, so a lot of people with the change of the seasons has allergies, but it could also be a common cold, right? And so there's, what do you do when you have upper respiratory infection and your goobers are coming out of your eyes, your nose, your ears? Like, how do you do when you're pregnant? What kind of medicine can you take? You're like, usually I take Sudafed. I hear this all the time. They're like, Sudafed, you can't have Sudafed in pregnancy. And so it's like, what can I do if it's just a bacterial infection?
Mm-hmm.
Well, why is chickenpox such an issue for pregnant folks?
Yeah, so especially when you get chickenpox or when you're exposed to it, depending on when your baby is developing, right? So when you are exposed or if you're become infected while you're pregnant, there's different things that happen as baby's developing that it can actually affect. So a lot of these different viruses that we get or these different infections can cause harm to your baby at different points in your pregnancy. So, um, and so there's a little chart that did I give that to you, Gabby? Well, actually, I don't think I did. That shows like what infections can actually harm what part of baby. So it's a lot, and there's so many different infections. So I'm like, I don't know all of them off the top of my head. So that's why we have
Mm-hmm.
charts for this. But what it's important to do is when you're feeling sick, when you feel off or you feel ick, right? When you feel the ickiness, it's worth it to just mention it to your doctor. Just mention it to your provider. Just say, "Hey, I've been burning down there and it doesn't feel good. I've had a fever for 4 days. I don't know what's going on. Is there anything I can do?" Right? And so a lot of times we just suffer through our pain. We suffer through like the itchiness. We're like, oh, it's going to go away eventually, but it
Mm-hmm.
doesn't. It's worse, right? Or we say, oh, it's just a fever. I'm okay. But a fever can really harm a baby, especially if we wait 3, 4, 5 days and you've had a fever for this long and your baby is like growing in a high temperature. That can cause different defects with your baby. So it's really important that if any time you feel icky, just talk to your doctor. Just call your midwife. Just let them know, hey, I've had a headache that's not going away. I feel like I've had the flu for 2 weeks now. This cough isn't going away. What can I do? Uh,
Yeah. And I know like infections can go beyond like common things like getting chicken pox or getting the common cold. Like, how about with your partner? What are some infections that we've in you've seen when helping pregnant folks?
Say that one more time. What are the infections that we've seen in partners?
Mm-hmm.
Um, well, if one person gets sick, the whole family gets sick.
Uh-oh.
They all do. So even with COVID, right? Like if
Mm-hmm.
one person has COVID, everybody has COVID in the family. So everybody has to everybody has to quarantine. Everybody has to be, you have to play it out together. You all get sick.
Mm-hmm.
So same thing with a cold. If somebody's sick in the family, if you don't isolate that person and treat that person, most likely the whole family is going to get sick. So that's the same thing with all infections, is that if you're having some sort of infection, most likely it could happen to other people. Is it okay if I talk a little bit about signs and symptoms of like what to look for if you think you're having an infection?
Yeah, of course. Go ahead.
Because sometimes, here's the thing, you may not know what's going on with your body,
You might just think
right?
that you pulled a muscle, or like, oh, it's just allergies, like you said.
Yeah.
Mm-hmm.
So there's this big thing. There's signs that we're looking for. It could be fever, like I said. You could have pain in your body, like your muscles just ache, like you wake up and you're so exhausted, you're not coming back to yourself. That fatigue is like you're definitely tired in pregnancy, but there's this point where it's like you can't even get out of bed. You're so exhausted. Something's wrong.
Mm-hmm.
Okay. We don't know what it is, but something's wrong. The other thing you can do is check your lymph nodes. And I taught this to my son. So if you start up here behind your neck, Gabby,
Oh.
and like I taught him to massage his neck and feel for all his lymph nodes, and then come under here and you'll feel it like where it's really swollen. And so it's good for you to feel it on your partner, like, oh, and then you'll start to, they should feel, you shouldn't feel anything. Honestly, you shouldn't. But if you feel like a kidney bean or a garbanzo bean in there, that's
Mm-hmm.
your a lymph node. There's lymph nodes all the way down your neck, like a triangle here. And then they come into the front of your clavicles.
Oh.
It's so if you have swollen lymph nodes and you feel it in the back and it just like I'm sick, so I can feel like where it hurts, like all of this just hurts. It's it's telling us that you're sick. Okay, so that's another common thing. Is like if you can't really turn your neck and it just hurts, your lymph nodes are swollen. Your body is telling you you're sick. If
Mm-hmm.
you're having cough, chest tightness, nausea, vomiting, diarrhea, those are all signs of infection. Uh, and then if you have any redness, rash, or swelling on your body, like if you notice a rash coming up, and a rash could be very likely in your vagina and on the outside, uh, and in between your legs. So always like just take a mirror, look at your whole body, do a full body inspection,
Mm-hmm.
see, oh, something's going on. Um, and so, like I said, there's 4 different organisms that cause infections. The first could be a bacterial infection, like you're sick. It could be bacterial vaginosis, where there's actually bacteria growing in your vagina that can cause this. And
What?
oh yeah, so and that's one of the most common is BV. Is and you get it from wiping. Well, it's so hard to wipe carefully, but like
Mm-hmm.
your anus is right next to your vagina hole, right? So if you don't wipe backwards away from your vagina, or if just one little tiny speck of your 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 poop goes up and travels into your vagina, that's enough to cause an infection. That's bacteria. So you know, taking showers regularly. There's things that you can do to help clean yourself to prevent it. But so the number one is bacterial infections. Number two is viral infections, which is like the common cold. There's really, you cough, you touch a door handle, somebody else coughed on that same door handle, and you touch it, you wipe your nose or your face. That's
Mm-hmm.
how we get it, right? So viral infections. The third one is fungal infections. So this is yeast. And so we'll talk a little bit about yeast because that's one of the most common infections in pregnancy. It's first UTI, then there's yeast infections. So we'll go a little bit into detail about those ones. And then the last one is a parasite. So a parasite can happen with a little bug that you
No,
eat on accident.
no.
Mm-hmm.
there's certain foods that we need to be very careful of when you're pregnant, and one of them is lunch meat. It's as simple as having turkey sandwiches, right? That sat out too long. Some deli meat can carry parasites. Cantaloupe skin, who knows? They always get recalled. So be very careful with the fruit and vegetables that you're eating. So you have to wash it really closely. Um, Another fun one is uh, anybody who's a cat lover and has a cat at home,
Mm-hmm.
their poop carries a lot of toxins. And so if you're pregnant, you should not be cleaning the kitty litter. It is actually very dangerous for you.
Okay.
If you are cleaning kitty litter, you should be wearing gloves and then wash your hands very thoroughly. So
Like,
there's
leave it to the other person to clean the litter. You don't have to do that.
you know how to do
Yeah.
that. Do you want to show this screen?
Yeah.
Let me see if I like blew through our slides
Okay.
already. Okay, so we talked about this. What causes infections during pregnancy? So that was the bacteria, viruses, fungal infections, parasites, and it's so simple to get it. You inhale some germs. You ingest contaminated food. So many of us get food poisoning from even going to the restaurant. So nothing's safe, right? You just have to keep looking.
It's just like a bunch of landmines everywhere you go.
Yeah,
Trouble while you're
it's
pregnant.
just a miracle that we can grow healthy babies.
Yeah.
Placental transmissions, so things that come into your body, your blood can actually go into baby, right? So that's why we're really afraid about these infections. Is there's different ways that it can go from you to baby, and it's through the placenta is one of the ways. Illicit drug use, sharing needles. Um, be very careful. It's okay to disclose if you are using drugs, if you are like using marijuana, if you're smoking, if you're drinking in pregnancy, please tell your doctor. Please. We are not we are not calling CPS over this. What we're doing is we're calling programs to get you into help and give you some resources and some tools that will help you stay safe in pregnancy and keep your baby with you after baby's born. So please don't try to hide that. Don't try to be afraid that you're going to lose your baby because you're using drugs or alcohol or smoking. There's ways that we can help you and protect you if we know. But if you hide it, that's how you lose your baby. So really, we see it all the time actually. We see this a lot. So the more you can disclose and trust your provider, the more we can help you. Uh, and then the last one is having unprotected sexual contact. If you're in an open relationship, you are at risk that you can have sexually transmitted diseases during your pregnancy. So at the beginning of your pregnancy, we'll screen you for sexually transmitted diseases. It's part of the Department of Health requirements. So we test you for herpes, chlamydia, gonorrhea, hepatitis. Like we go through a whole screen of the common STIs, HIV. So we test you for all of that at the beginning, and then we'll test you again at 28 weeks. The hospitals are now being recommended to test at labor
Oh wow.
because it's happening that much
Oh my
that
gosh.
people are coming into labor with
And
the.
sorry.
Go
Um when you talk about tests, like what does that mean? Does it mean like a blood draw? Does it mean like a urine, like peen?
Yeah, good question. So and this is just for STIs. For STIs, we could do it three different ways. We can test your blood, which when you do a full pregnancy panel, we do a blood draw and then a urine test and then a swab. So those are the three ways that there's some things that we can find through a blood draw. There's some things that we can find from a urine test. And then what we like is called an abdomen swab. So it's just a swab, and you take a little Q-tip that we give you, and you insert it into your vagina just a little bit, and you swirl it around, and then wipe it on the outside of your anus, and then you put it into a solution. And so then we send that all out to the lab. They do that again at the hospital so they can check for those infections.
I
Um,
think I think Tara, we need to actually clarify what an open relationship is because a lot of people don't know what that means, and a lot of people are in one, but they are unaware they are in one, as my friend said.
Mm.
awesome. How about you tell us, what does that mean? So, what is a monogamous relationship
Two people,
Two people.
with one partner? So you have one
one.
partner. Okay.
But an open is when you both agree, hopefully, that there's more people in your relationship. Is that the simplest, easiest way to say it?
Yeah.
But again, there's some people that are in one and are not aware they are in
Mm.
one, right?
Are you saying that people cheat?
Yes, a lot.
Okay.
Well, like that's also one of the reasons I wanted to be here is because one of my friends she was like she thought a committed relationship, and then she found out when she was 7 months that she had her partner had been having sex her husband had been having sex with all these other women throughout her pregnancy,
Oh
and
my gosh.
unprotected with the other women and unprotected with her. So that was really dangerous, and that's what she was mostly mad at the dangers that he put baby
Mm.
in.
Wow. That's.
In pregnancy, it's actually when cheating goes up. So there's a lot of studies that say, uh, well, being pregnant is hard. Being
Mm.
with a pregnant person is very hard. And so this is a time when a lot of people cheat on their spouses, their partners. It's also another time when domestic violence goes up, is during pregnancy. And so it doesn't surprise me that we're seeing these infections go up as well. Yeah. So, these are some, gosh, there are some really hard conversations to have. And as midwives, it's kind of sad, but we've done this many times where a partner will call and just say, "Hey, can you test me? I just found out my boyfriend cheated." And so we test, and they're positive for the first time in their life for HSV,
Gosh.
right? And so, there's some really serious consequences that can happen if you have some of these sexual transmitted diseases in pregnancy. Uh, Gabby, do you want to go to the next slide? Because I
Yeah.
think it tells us, it kind of breaks it down. Um, Gosh, can we see it a little bit closer? So the first one that I was talking about was that bacterial vaginosis. So that's one of those bacteria. It's a bacteria. It's nobody's fault. Like, we think BV is a STI, but honestly, it's just unfair, and it's cruel, and it can bacteria can get into your vagina and grow, and it can cause preterm labor.
Oh
So,
my gosh.
and that's something, preterm labor means baby is born early. They may have difficulty breathing. They may need to be admitted to the NICU. So there's a lot. It's just a lot when you have a young baby. Um, Chlamydia can cause pneumonia and eye infections with the baby. Um, Gonorrhea can cause preterm labor, eye infections, and blindness.
I know that in our classes, sorry, we've
Yeah.
covered like postpartum and then some things that the doctors and our midwives can do to prevent like the infections from spreading. And you said that vitamin K oil or something like
Oh,
that.
so yeah, so good job remembering. So we use this eye ointment called erythromycin, and so it's given at delivery. So, like right after baby's born, we'll just do some eye ointment right into their eye and like let it sit there on both eyes for for I don't know, it's about 30 minutes that it'll just stay there and we don't wipe it off, we keep it there. And that's a antibiotic. So it actually can help to destroy that. And ever since they started using the antibiotic on all the babies, the level of blindness has gone down. So we know it works.
Hey.
The other one is called Group B strep, streptococcus. So this is another unfair disease that happens or infection that can happen. Everybody has Group B in their body. It's just part of your natural gut flora, and there's a lot of bacteria in your body, and it's okay as long as you're an adult. It's not okay for a newborn baby. So we actually test everybody before they get into dates around 36 to 38 weeks. We'll go and do a swab. We have them do it. And just like that other swab, you take a Q-tip and you wipe your vagina, you go inside, swirl a couple times, and then do the same thing, wipe around the outside of your anus. And they put it into a gel, and then we have that sit and grow for 3 days. And it tells us if there's any group B strep growing. And if it does, it can be very, very hard on the baby's lungs, and it can be very fatal to them if they're born and inhale that into their lungs. So what we do is if you're GBS positive, then when you go into labor, we'll actually give you some antibiotics to help give your baby. So if we give you the antibiotic, it'll go through the placenta into baby. So baby will actually have antibiotics on board before they're born. So that will help them to keep protected from the GBS.
Can a parent refuse that?
Absolutely. You know, you can actually refuse any of this.
Hmm.
You can refuse to be tested. You can refuse to know and be treated and say no. You can refuse to be any of this along the way. But here's the thing I always want you to know is you're the parent, right? So this is your baby that you're in charge of. This is not the baby that Lika's going to go and raise or Gabby. This is your baby. And so whatever decision you make affects the baby that you are going to raise into adulthood. So these questions that you have to decide, these decisions you have to make, you have to decide like for the fate of your whole person's life. So I just want you to weigh these consequences, right? So look at what is the risk, why is it worth taking, do I want to know the information or do I not want to know? Why don't I want to know? What are you afraid of? What do you think is harmful? So I can't answer those questions. My job as a midwife is just to teach you, here's all your options. Here's what's in front of you. Here's what we do know. We know you are GBS positive. We know that people uh, before people didn't have antibiotics, thousands and thousands of babies were dying. Now it's only a couple hundred that die out
That's
of,
a that's such a big impact.
yeah. So having antibiotics for you, is it worth it? It's up to you. Is the risk worth it? If you've ever had a baby in the NICU for 2 weeks, like I have, never. I would never compromise because I would never want to put any other baby in the NICU for that reason. So, and these are not these infections that I'm talking about. These are not just a common cold and this baby is going to be okay. These are huge, serious developmental delays that are going to affect the baby for the rest of their life, which means if you don't want to give them antibiotics at the beginning of their life, they're going to be stuck with you their whole life because they'll never be able to walk. They'll never, one baby will never be able to see, literally blind. So, I just want everybody to know when you make these decisions, it is a lifelong choice for another human being. Does that make sense?
It's a
Mm-hmm.
good
No,
point.
that's a good
Yeah.
point.
Okay, let's see. What's the other one? Toxoplasmosis. That's the cat disease. Okay, so cat poop, it's serious. There's some congenital defects that can happen. Listeria is the one that is from the turkey and from deli meat, hot dogs. It can cause stillbirth,
Mm.
miscarriages, and other congenital disabilities. Cytomegalovirus, CMV, and then Zika. Those are big ones, stillborn and miscarriage. So
Mm-hmm.
Zika is from the mosquitoes, right? So if you're traveling in certain parts of the world where they're known for the Zika virus, uh, one, I would just not travel when I'm pregnant, or two, if you have to travel, cover up, wear clothes, wear bug spray, do all the things that you can to kind of avoid getting hit by mosquitoes. But these are not just, oh, my kid's going to be sick in the NICU for a couple weeks. These are, my kid is going to be sick. I'm going to have to take them to children's every month for an appointment. They're going to be in braces. They're going to have to learn to walk. They're going to be developmentally delayed. These are really big disabilities that will happen to a baby.
Mm-hmm.
I was like, "You sure you want to talk about all this
Yeah,
today? So heavy."
well, it's good to have because I feel like in our community, conversations about like sex or things like this isn't mentioned, especially for youth, and so we have to either not know the answers or we can go on the internet, and so having these conversations helps in preventing things like this. So thank you so much for sharing, Tara.
Good to talk about the ick.
Yes,
Yeah.
Day.
Uh, can I talk about the normal stuff?
Yes.
Okay, let's talk about, and it's ick and it's itchy and it's horrible, but it happens very often. Almost everybody gets at least a yeast infection and a urinary tract infection, and those happen all the time. So you can get it in pregnancy or outside of pregnancy. So this is for all the folks out there. Uh, to just watch for some of these signs and symptoms. For, let's talk about I think yeast first. Is that what it is, Gabby?
Mm-hmm. Yeast. Oh, sorry. Let me go ahead and put the slides back up.
Okay. Y'all know that feeling where you're like, no, it's burning, it's itching. Um,
Mhm.
Mm-hmm.
if you ever have, yeast going on or growing, any itching or burning, take a mirror and actually look and see what's going on. Okay. So check to see if there's any swelling, check to see if there's any thick white discharge that's coming out. And the yeast has a smell to it. It's not, it actually smells like yeast, like bread yeast. So I know that's kind of icky, but that's one thing you could do. I don't know. Lika, you have a family of girls. Like, what are some of
Well,
the things
I
that
was just trying to envision a pregnant person trying to look down there with the mirror. That
Yeah.
would be so
uh,
hard with the belly. They're gonna need help.
or
Mm-hmm.
have somebody help you look and use the
Yeah.
mirror. Have somebody else hold a mirror so you can see. But those are the things. That's the big main one, is that there's thick white vaginal discharge. It's super
Mhm.
itchy. It does not have to. It does not have to stay like that. Like, if you feel like this is going on for months at a time, please please call your doctor. Let them know. There's things you can go to the grocery store and get things to knock this out right away. Um, Most people use Monistat. If you're not pregnant, you could just do the one dose. It's super strong, and you insert something into your vagina, the medicine. But when you're pregnant, that is too strong. So we
Oh,
actually don't want you to use the Monistat 1. We want you to use the Monistat 7. So use the full 7-day one. So it's a little less, but it
I
knocks you out pretty quick.
I did not know that monostat one was too strong. What?
Too strong in pregnancy. Yeah.
Yeah.
you have to take it in small, in like doses.
So Monistat 7 will give you that dose in 7 doses. Yeah.
Hmm.
Oh,
Do you know what it does to you? The one dose? Just curious.
So yeast infection is all about preterm labor, right? So anything that's too, uh,
Oh.
yeah,
Oh. It was funny though. The friend that I told you that her partner was,
yeah,
she only found out because she thought she went to her appointment and she said, "Hey, I think I have a yeast infection. Can you guys give me something for it?" And they checked her and they saw other things that she couldn't
yeah.
see. So
Oh,
that's how she figured out she had herpes during pregnancy and she got it during pregnancy.
oh.
Yeah, it was
So with
devastating.
herpes, you see blisters.
But she couldn't see.
You
Right?
can't
Yeah.
see. Yeah. Oh, I'm sorry.
Yeah. It was traumatic for her.
It's so emotional and so traumatic. And
Yeah.
that's why we don't want to know, right? Like sometimes we would rather just live with the itchy to actually know something's going on.
Mm.
mm.
But
That's
you know
not
what? Your vagina never lies.
It tells the truth always.
It tells the
Oh,
truth. Your vagina knows what feels good and what doesn't feel good.
that's a good.
So if you're with your partner and your vagina starts telling you something,
Go check. Yes.
Yeah.
listen to your vagina, man.
Mhm.
Okay.
Okay. Next slide.
Oh, okay. So the next one is UTI. So the signs and symptoms of the UTI is the frequent urination, where it's like almost every hour and it's really urgent. Like you have to go right now. You stand up and you like start peeing on your way to the bathroom. If this is happening often, you know, I know when you're pregnant, like baby is sitting on your bladder. This is a different kind of feeling. Okay, so I want you to know if like there's that feeling that you always have to pee because of a baby, but this also hurts. This one is painful. It burns, and you also feel sick. Okay, so you'll have a fever, you'll have chills, you can experience nausea and vomiting, and then the big one is the lower back pain. Like, and I'm talking, by the time it's a UTI, so uh, it's a urinary tract infection, and then if it starts to get up to your back, it turns into a kidney infection. Okay, and
Um,
then and it hurts like if and we test it. We put our hands on your back like this, and then we just do a little pat. If I just do a tiny bit, they will jump off the table. They're like,
Oh wow.
ah.
oh.
That's a kidney infection. Okay. And what's worse is if there's kidney stones.
Oh.
So,
Oh
so
no.
this
Sorry.
is an ER visit. Okay. This is
Okay.
like we are sending you to the ER if you have any of this. Uh, Take a look at your pee. It's always good for you to know your body. So, look at your pee. Look what's coming out. What color is it? Is
Mhm.
it cloudy? Is it blood tinged? Does it look red? Does it smell really strong? If it does, something's wrong. You want to have a nearly clear urine.
Mhm.
You really do.
Drinking
That
enough water.
that means you're drinking enough water. If it's dark, if it's yellow, if you smell it, you need more water. So always look at your pee, always look at your poop,
Mm.
and see what color is your poop. Is it a good consistency? Was it diarrhea? Is it nicely well formed stool? Is it soft? Like, is it a nice log? I do this because you're walking your dog, and I know if my dog ate chicken, like she knows she's not supposed to have chicken. She loves chicken and she loves spaghetti. So if she eats any of my son's food, leftover food, I see it in her poop
Mm.
because her poop will be smushy. I've got her onto the right diet that she has the perfect poop, right?
Mm.
Because I have to pick it up with my hands in the bag. So, so same thing with you. You should know what a perfect poop looks like. You should know what perfect pee looks like. You should be very comfortable when you wipe to see if you have any discharge. And it's okay to look at the discharge. It's okay to touch it with your fingers and see, is it stringy? What does it look like? Like when we get into how to get pregnant, we'll talk about discharge. It's so important.
Huh.
So,
Mm.
Interesting.
Wow.
Never thought to touch discharge.
we could do a whole 1 hour on vaginal discharge if you want.
Oh.
All right. And then what's the next slide? What did I do
Next
for
slide.
this?
Oh,
Oh, okay. So this is tips. This is just good lifelong things that you should remember to prevent UTIs during your pregnancy. Drink lots of water. Like so much water. It's half your body weight in ounces. So if you weigh 200 pounds, then 100 ounces of water. That's 3 of those big bottles, 30-ounce bottles. Drink 3 of those a day. So that's kind of your goal. Try to get 2 or 3 of those in a day. Um, Avoid using public toilet. I don't know about that. But maintain hygiene in private areas. Wash yourself. There's these nice cloths that you can use now, wipes that are disposable. The other thing that's really good is to urinate regularly. So if you've gone 4 to 6 hours without using the bathroom, get up and go to the bathroom. Because if you just hold that old urine and it's just sitting in your bladder, that actually is what can cause UTIs. I have a niece who is 10. She's going to be like, Auntie, but she would never pee. And so she would always get UTIs when she was little. So we would have to force her and we'd have to sit and nobody could go anywhere until she would pee. So it's important because the UTI, it's just not fun to have a UTI as a child. So
Military brats are also trained not to pee.
why?
Driving across country, moving every year. You
But you
have to.
don't stop every 2 hours.
you can just
No.
stop in the middle of the road.
The only time you're allowed to go to the bathroom is when you stop for the gas fill up. That's it. There's no in between stops.
Oh
So
man,
you get
that's
trained really
hardcore.
fast. I'm great at it. But
Wow.
never had a UTI. So
The other thing is to wear loose fitting clothes, breathable cotton. We've been seeing a lot of folks coming from the asylum seekers that are coming and walking for months and months to get to the US, and they're wearing all their clothes on their body, and we've noticed UTIs from wearing tight clothes. So help your body out, and then avoid using harsh products like soap. You don't need to wash with harsh soaps. You don't even need to douche. Okay. You can just use clean water and and that's enough. Some people like to use yogurt. That's fine too. You can use plain
right?
yogurt as a wash, because it has bacteria and it has natural probiotics. That's the other thing that doesn't say here, but use a probiotic. When you're pregnant, we say use a really good probiotic, the kind that you leave in the fridge. those are good ones. So femdophilus is a nice one that you can use. Um,
Wait, they make probiotics for the vagina?
yeah, so it's called
Mm.
like feminine femdophilus, and you buy it. It's refrigerated. So when you go to PCC, or you could go to the vitamin store, tell them you want like the good kind, and so you can take it by mouth, or you can put a capsule in your vagina if you need to.
Whoa.
Did
Yeah,
not know any of this. What?
all
Wow.
the good things. Yeah.
Huh. And
Dang.
not just a probiotic vitamin.
Yeah, like they're fine, but if you want to really like improve your gut health
Hmm.
as a woman, then use the one that's designed for women.
Mm.
Yeah. So ensure
The,
a healthy diet. That's yeah, these are good. So, it's we're kind of wrapping up, but I
oh,
think that was it, right? Right,
wait,
Gabby?
wait. So urinating regularly and that's also after sex. Like I don't think, right? For you that helps.
Absolutely.
Oh,
Okay. So everybody after sex go pee.
go.
Okay.
Yeah.
That helps to just get things out, right?
Yeah.
Like when anytime that you're putting foreign things into your vagina, just do a little squirt, wash it out, go pee, pee out all the bacteria, anything that can harm you. Protect it with your life.
Mm. Mm.
Oh
We
man.
gotta make T-shirts so out of some of the things you're saying, Tara. So
The ick factor,
those little
your pod
squirts.
Oh my
knows all, knows the truth.
Oh yeah, the vagina
Yeah.
knows all. That's the best T-shirt of all.
Yeah.
gosh.
Good.
So same thing with this, with all the other infections. Practice good hygiene. So washing your hands before you're gonna wipe, or after you wipe, or when you're about to cook food. Wash your hands. Wash your
Mhm.
vegetables. Like, uh, if you're sick, wear a mask, and it's to protect you, and it's protecting you when you're out in public. Just wear a mask. Like, we traveled, my son and I traveled the world, and we were on a 12-hour flight and a 9-hour flight. You better believe we wore masks the whole time,
Mm.
because everybody on the plane was coughing.
Oh.
So just know, people are not doing it anymore. They stopped taking care of their hands and their face, and
Mm.
here I am in the summertime with the sick. I have a cough.
Mm.
So infections come in 4 different ways. That's what we learned today: bacterial, viral, uh, fungal,
And parasite.
and parasites. Good
And
job.
yes.
So just think of all the ickiness that can happen, and what can we do to prevent it? Yeah.
Yes. But it was lovely having both of you on today's live. Please, again, if there's any questions in the chat, please feel free to leave them and then we can answer them after. But again, thank you so much for hopping on today, everyone. Have a great day.
Thank you. It's good to see you all.
Bye.
Bye.
Bye.